Guys, warning, the video you are about to see may contain some sensitive content, so viewer discretion is advised. Keep in mind that the number one thing to do in case of an emergency is to always seek medical advice from a healthcare professional like a vet. If you're able to take your bird to the vet, that is the very first option that you should take. Now, in case that there is no vet available, in case that you are in a location where that's not a possibility, then hopefully today's video will help you out. You know, a lot of people ask me how it is that I come up with the topics for these videos, and most of the time, all of these topics are premeditated. I think about a very specific topic that may help you, the viewer, out, and I make a video about it. But from time to time, we have those videos that pop up that are completely unplanned, and that is exactly what happened in today's video. Now, I've had some of these in the past, like for example, the one that I did probably about a year ago with an egg-bound hen, where I showed you guys how it is that I take out the egg in order to help this hen so she doesn't die. And in today's video, you're going to see the complete opposite of that. This is a hen that was able to, on her own, pass the egg, but unfortunately, due to the strain of how big that egg was, it caused a prolapse in her cloaca. Now, if you have birds, sooner or later, you're going to have to deal with some sort of emergency, whether that's a bird that has a bleeding toenail, whether that's a bird that is egg-bound, or a bird that has a prolapsed cloaca, and so on. So it is very important for you to be a bit versed in some of these things and how to react quick enough if you're not able to get that bird to the vet. In my case, this is something that I noticed very late, just shortly before lights out in the bird room. And I noticed that one of the hens that was in the lower cages had a prolapse. Now, once you spot this, it is very important to act quickly. You don't have much time, you just need to act. And if you can't get to the vet, you have to try to do the best that you can with what you have. And I'm going to show you step by step some of the things that you can do at home in order to help a bird that has a prolapsed cloaca. We're going to try to keep this short, simple, and to the point. When you see the cloaca exposed, as you see with this bird right here, you have to act very quickly because this cuts off the circulation to that cloaca. What happens is the longer that this cloaca stays outside of the body, the faster it's going to lose circulation, the faster it's going to dry up, and then eventually the bird will end up dying. So the very first thing that we're going to do for a bird like this is we're going to obviously grab them, pull them out of the cage, and we're going to do something to that cloaca to keep it moist or to try to clean it. It's been out of her body. We want to avoid infection. So what I used was saline spray. And what I'm doing with the saline spray is very simple. I'm just spraying it all over her cloaca. I'm trying to, one, rehydrate her cloaca to make sure that it is moist and not dry. And two, I want to get any fecal matter or any dust, dirt, or debris that it may have collected while it was outside of the body. The last thing that you want to do is put the cloaca back into the bird while it is dirty. This is a recipe for disaster. It means that this bird's going to have an infection and it's not going to heal properly, and most likely that bird will end up dying. So after spending a few minutes of moistening her cloaca with the saline spray and cleaning it off, we're going to slowly try to introduce that cloaca back into the inside of her body. And the way that I do this is I grab a Q-tip, I moisten it with the same saline spray, and I slowly start to push that cloaca back in. Now, you have to be extremely patient with this. You can't push hard. You have to slowly do this, and you have to take a look at the bird. What is the bird doing? Because at points, you may notice like the bird is straining or pushing. You want to try to avoid that. The more the bird pushes, the more that cloaca wants to come back out. So slowly introduce that back in, and slowly but surely you start to push it back in. It takes time, but eventually that cloaca will go back inside of the body. As you can see here from the video, it is a bit sped up, but it probably took me about, I want to say, 1.5 minutes, 2 minutes to get the cloaca to go back in. Once you get the cloaca back inside to its proper location, you want to clean the vent. Clean off the vent, any excess poop that you may have on the vent or anything like that, get it cleaned out. And then you want to grab your bird and put it inside of a hospital cage. Now, while inside of that hospital cage, you want to make sure that you have a couple of different things. One, a heat bulb. That bird has been under a lot of stress. Most likely it's going to fluff up. A heat bulb is going to help that bird recuperate its energy or not have to waste energy keeping itself warm. So that heat bulb will keep the bird warm, and it can use that energy now to continue fighting forward and getting better. Another thing that you want to do is you want to place food and water down low. You don't want the food up high. You don't want the water up high. You want to keep it simple so that the bird is able to access it. Another thing that you want to do is you want to make sure that you add some sort of antibiotic to the water. We all know that now the cloaca has been outside of the body. There's a possibility of infection. So the last thing that you want is, after helping the bird get its cloaca back in, you don't want it to die from an infection. So giving the bird a form of antibiotic will help it fight off any sort of infection that it may get. Now, all of these things take time. Once you get the cloaca back inside of the bird, once you put it in its hospital cage, it has its heat bulb, it has its medication and so on. It's going to take a couple of days for this bird to get better. This isn't something that's going to happen overnight. Keep an eye on it. Make sure that it's improving. If your bird takes a turn for the worse, take it to the vet. Now, one of the things that I'm doing with this one after doing this is I'm obviously going to monitor it for the next few days. If I see tomorrow that there is no improvement in this bird, then obviously we're going to the vet. But if I see that the bird slowly starts to improve, then we are in the clear with this one. Now, another thing that may happen is, and it happens quite often, is a relapse or a prolapse again of the cloaca, because you push it into the bird. It may get better for the time being, but the following day the bird starts to push again, trying to defecate. Boom, the cloaca pops out again. So if something like this does happen, then you do need to immediately take this bird to the vet, because the last thing that you want is to leave this cloaca hanging out after, for example, in my case, I saw this at around 8 o'clock at night, and the vet doesn't open till 8 or 9 in the morning. 10, 12 hours pass, the cloaca's out. By the time that we take it to the vet, that cloaca's dried up. So this is a guide to help you out in case you can't make it to the vet. But remember that the very first thing that you need to do, if possible, is take your bird to the vet, where a healthcare provider can administer the help that that bird needs. And usually when you see a prolapse or a reprolapse of the cloaca, again, what the vets will do is they'll suture it up. Once they insert it, I've heard of some vets that they will suture the cloaca to the last rib so that it doesn't fall back down again, or they'll suture it in a way where it won't prolapse anymore. But also keep in mind that once something like this happens to your bird, it will no longer be able to be used in the breeding season. So if you have a bird that has a prolapse, once it gets better, do not use her again for the breeding season. Unfortunately, this bird will no longer be able to, or could it possibly breed again without a problem? Sure, but you're always putting the health of that bird at risk, because if it happens again, chances of it surviving are going to be a bit smaller, so to say. So you don't want to use, anytime that I have this, I don't introduce that bird back into the breeding program. They will make great pets, so you can keep it as a pet, but do not reintroduce it into the breeding program. All right, guys, I'll keep you all posted on the progress of this hen. Hopefully she makes a speedy recovery, but now at least you know what to do in case of a scenario like this one. Like always, guys, if you've enjoyed the video, remember to give me a thumbs up, like and subscribe, and we will see each other in the next one. Bye.